Thanks for joining us for a special interview right now. We're going to go to Dr. Felton. He's at Riverstone Health giving us an update on the COVID-19 pandemic as we head into the holidays.
There's a COVID-19. It's been nearly 9 months since the first COVID-19 case was reported in Montana. I know that people are tired and stressed by the pandemic. We're extremely concerned about the toll this pandemic has taken on the health of our neighbors who have been hospitalized with severe illness. We're also concerned about the unrelenting burden the pandemic continues to place on our local public health and healthcare systems. During November, St. Vincent Healthcare and Billings Clinic together had an average of 138 COVID-19 inpatients hospitalized each and every day of the month. Every day of November, between 29 and 41 patients were in the hospital's intensive care units because of COVID-19. Since the pandemic began, at least 129 Yellowstone County residents have died of COVID-19 related illness, including 26 who died in November. Most of our neighbors who died of COVID-19 were older adults, but we did have some who sadly lost their lives in their 30s and 40s. During the month of November, nearly 4,200 Yellowstone County residents became ill with COVID-19. This is the highest number of residents testing positive in a month since the beginning of the pandemic. If each person who tested positive during November had only 4 close contacts, at some point last month, that means there were 21,000 people in our community who were either isolated or quarantined. 21,000 people is the combined population of Havre, Whitefish, and Glasgow. The number of new cases in Yellowstone County remains dangerously high, but we have decreased from a peak of 108 daily new cases per 100,000 population in the week before Thanksgiving. The week of Thanksgiving had an average of 74 new cases per 100,000 population, and the week of December 5 ended with an average of 69 new cases per day per 100,000. We track this number of new cases carefully because infectious disease experts have determined that any daily average above 25 per 100,000 to be a critical level. We are still at extreme risk of overwhelming our healthcare system and our public health system even as we see these decreases. We're also just beginning to see infections that may have been acquired during the Thanksgiving holiday. I sincerely hope that our Yellowstone County friends have limited travel and celebrated the holidays safely so that we do not see a rise in infections, hospitalizations, and deaths. This risk of new infections is why I'm extending the health officer order I issued on November 19th from a termination date of December 31st until an end date of January 31, 2021. This extension will also allow a sense of continuity and certainty as we get into January and the governor-elect assumes office and we see his plans for managing the pandemic. We still need to reduce the risk of infection by keeping our gatherings small, under 25 people. To keep our families and friends safe, we need to continue the 50% of normal occupancy limit on places where we gather, such as bars, restaurants, stores, gyms, churches, and other places of assembly. The extended order also continues the requirement that most places of assembly close at 10 p.m. and remain closed until 4 a.m. Drive-up and delivery food services may continue between the hours of 10 p.m. and 4 a.m., but no customers are allowed inside the restaurant. The previous exceptions for places like healthcare and daycare facilities will continue. In recognition of the need to keep commercial freight moving through our state, this new health officer order also makes an exception to allow sale of commercial transportation fuel at businesses within a mile of the interstate highway if pay-at-the-pump service is not available. Self-service pay-at-the-pump fuel services are still permitted to operate 24 hours per day. All other services at such places, such as retail sales, food and beverage sales, and so on, must close between 10 p.m. and 4 a.m. This is consistent with the way the order treats pharmacies that are open past 10 p.m. In November, Riverstone Health hired 4 COVID-19 education liaisons with expertise in state law and enforcement to respond to complaints about the lack of compliance with pandemic safety protocols. This education team is funded by federal COVID-19 relief money distributed by the state under an agreement with the governor's office. The team is working closely with the Yellowstone County Attorney's Office to promote public health and safety. During the month of November, the education liaisons received 296 complaints through Riverstone Health and 221 complaints through the State Health Department. 89% of complaints were about customers or employees not wearing masks. The other 11% focused on lack of social distancing, staying open after 10 p.m., or lack of signage informing the public about these requirements. Between November 16th and December 6th, our liaisons visited 189 businesses in Yellowstone County that were subjects of complaints. For the most part, these businesses were in substantial compliance with COVID-19 health orders. Where non-compliance was noted, education on how to achieve compliance was provided. The team will continue to respond to complaints, make spot checks of businesses previously visited, and provide education as needed. Let's turn our attention now to the updated CDC Quarantine Guidance. The Centers for Disease Control and Prevention still recommends 14 days of quarantine for people who become exposed to COVID-19. The time between exposure and becoming infected can still be up to 14 days. However, last week the CDC approved two other options for quarantine. The first one is to stay home and away from others for 10 days. If no COVID-19 symptoms develop in that period, then the person can end quarantine if they continue to monitor themselves for symptoms through day 14. The second new CDC option is to end quarantine after day 7, if and only if the person has no symptoms and is tested negative for COVID-19 5 days or more after the exposure. In addition, the person should continue to monitor for symptoms for the remainder of the 14 days. Anyone who is released from quarantine prior to 14 days must be extremely vigilant about wearing their mask, maintaining their distance, and maintaining hand and surface sanitation. We must recognize that shortening the quarantine period increases the risk of post-quarantine disease transmission. That risk is offset against the socioeconomic and academic risks associated with longer quarantine periods. As we've seen throughout this pandemic, there are no risk-free options, and we must take all reasonable measures to balance the risks at play. The Unified Health Command supports the updated CDC Quarantine Guidance. Unfortunately, we do not have the capacity to provide testing for people who have no symptoms and want to end their quarantine after day 7. The safest bet remains to quarantine for the full 14 days in case symptoms should appear. But if shorter duration options are chosen, those contacts need to be very careful and vigilant. Okay, let's talk a little bit about vaccines. We've been notified that Billings Clinic and St. Vincent Healthcare may receive their first shipment of the safe and effective Pfizer COVID-19 vaccine as early as next week. We understand that the first shipment will be less than 2,000 doses in total, but I've been sure that in the coming months, more vaccines will arrive. As we've managed the pandemic and other health situations in the past, the Yellowstone County Unified Health Command, which includes the 2 hospitals, Riverstone Health, and the Yellowstone County Disaster and Emergency Services, is working to distribute the limited vaccine doses according to the protocols and priorities established by the CDC. The highest priority group is healthcare workers who have direct contact with patients, including workers in senior care facilities. Residents of senior care facilities also have high priority and will be among the first people to be vaccinated as supplies become available. We don't yet know all the details of when more vaccine will arrive or how many doses will be shipped to our community. We do know that COVID-19 vaccines are being subjected to careful scientific review to assure that they are safe and effective. We will work to keep the community updated as information becomes available in terms of more vaccines. We also know that it will take many, many months before enough people in our community are vaccinated that we can begin to relax the individual protective measures we all know so well. I implore everyone to remain patient for a while longer and stay vigilant in wearing your mask, watching your distance, washing your hands, sanitizing surfaces, and limiting the duration and number of your non-household contacts. These are difficult times. In these challenging times of loss, grief, and worry, sometimes people don't know where to turn to help with those feelings. These feelings are often heightened during the holiday season. To assist our community, we have partnered with How Right Now, a CDC Foundation initiative that offers information and support to help people cope and be resilient. At howrightnow.org, you can find resources from trusted organizations along with personal stories of how other people are coping with the pandemic. We'll be sharing tips from How Right Now on our Riverstone Health Facebook page, and there's a link to How Right Now's website in our Coping with COVID-19 section of the COVID-19 website, which is covid.riverstonehealth.org. We also would offer some other free mental health resources for Montanans, including the Montana Crisis Recovery Hotline. Call 877-503-0833 to receive free confidential counseling services from trained crisis counselors from 10 a.m. to 10 p.m. on weekdays. The crisis text line is available 24/7 by texting MT to 741-741. The Montana Suicide Prevention Lifeline is available 24/7 at 800-273-TALK or 800-273-8255. And the Warm Line is available 8 a.m. to 9 p.m. weekdays and noon till 9 p.m. on weekends at 877-688-3377. We all want to celebrate the upcoming holidays with family and friends. Those connections are important, especially during the pandemic. But we need to keep doing all the things we know reduce the risk of spreading COVID-19. I strongly urge you to stay safe and stay home for the holidays during this pandemic year. Any travel that exposes you to people outside your household potentially exposes you to COVID-19. Any gathering with people outside your household potentially exposes you to the infection. Stay safe, but stay connected by phone calls, video chats, and Zoom. If you decide to have visitors or travel, please be careful to consistently maintain the basic infection control steps we all know and we've heard so many times. Keep at least 6 feet away from people who don't live with you. Avoid crowds, wear a mask, and wash your hands frequently. If you're sick, stay home. Tell friends and family to stay home if they are sick. I wish everyone safe and happy holidays. By taking personal responsibility to slow this pandemic, we can help protect our family and friends. That's the most important and meaningful gift we can give this season. Thank you all for coming. I'll now take your questions.
So Cornelia with Color 8, we talked about the COVID-19 education liaisons. How many complaints you would take for a case to be filed before you move to the next step?
So whenever a complaint is validated, that information is shared with the county attorney's office. The county attorney's office, then it's outside of us. It's their decisions to what the next steps are.
And is that public information, or is the public able to find out where or which businesses complaints are filed against?
You know, we don't make that public because potentially those are prosecutable offenses and people have rights to privacy, so we don't share the list of complaints.
You mentioned the
John. Oh, sorry. Go ahead.
You mentioned the new governor. You or Unified Health Command been in contact with the new Forte transition team on what they plan to do as far as gubernatorial orders and other things like that?
We've not had that discussion directly. We do know that the governor-elect has appointed a coronavirus advisory task force that's been meeting very regularly to advise him on what steps the group would recommend, but we have not had that direct conversation with him.
Do you expect to have that before he's inaugurated?
We've reached out to the governor-elect's office and have offered to and asked for a conversation, but at this point, nothing is scheduled. There's a question on the phone?
Yeah, John, this is Mike with the Gazette. You mentioned that the first shipment of the Pfizer vaccine is going to be, I think you said, less than 2,000 doses, and that healthcare workers who have direct contact with COVID-positive individuals are going to be a top priority in the vaccination rollout. Do you have an idea how many doses it would take to cover all the county healthcare workers who fall into that category?
The hospitals know their numbers. Our top tier of people who have direct contact is 93 people, but of course we are by far the smallest of the three healthcare entities. So I don't know what numbers the hospitals have in terms of those that first top priority tier.
Okay. Yeah, and similarly, I mean, you also mentioned a priority is going to be senior care facility residents. I mean, do you know how many people fall under that category in the county?
I'm not sure what that number is. The senior care facilities are receiving their vaccine through a different route. It's not through the doses that are coming to the hospital. CMS federally has worked with two national pharmacy chains to provide vaccine to the senior living facilities.
Okay. I think just one other related question on this, and then I'll turn it over to somebody else here. With that first shipment of vaccine, do you have any idea how, obviously we have multiple facilities with workers who fall into this direct contact category. Do you have any idea how it's going to be prioritized? And sort of what will be done with if there are remaining doses after that? I mean, how is it going to be prioritized going down the list?
Yeah, so each one of the three major healthcare organizations, Riverstone Health, Billings Clinic, and St. Vincent Healthcare, have identified internally their prioritizations, and then those are worked together through the Unified Health Command to come up with a community prioritization scheme. We know that there's not going to be enough doses in the initial shipment to vaccinate everyone. So we've all established who is our highest risk, highest priority subgroups.
Yeah, I guess what I'm trying to ask is are you going to be trying to hit all of the healthcare workers, for example, with direct contact? Are they going to be the ones who get, until the first shipment of doses runs out, or is it going to be distributed among other groups simultaneously?
The first shipment will go to those who have direct contact with COVID-19 patients.
Okay.
And will likely take all or virtually all of the doses that are available.
Okay, thanks.
Other questions?
John, this is Chris with the Montana Free Press. I just have a question about the kind of the declining infection rates per 100,000, I think, with which you talked about. Just generally, what does that tell you about kind of the trajectory of cases and new infections, at least here in Yellowstone County? And then I guess the part B would be, are we past the point where we would see, any other kind of bumps from, Thanksgiving gatherings, et cetera?
Yeah, so, the trajectory statewide and in Yellowstone County has come down. It peaked out several weeks ago, earlier in November. So we've seen a reduction of cases throughout the region. We're now 14 days out from Thanksgiving, but really not a full 2 weeks out from the end of the long weekend where people might have gotten together. We saw an increase in our number of cases locally today. We've been 71 and 81 the last 2 days, and we're at 147 in Yellowstone County today. You can't draw significant conclusions off 1 day's worth of data. We're really not convinced yet that there's not going to be a Thanksgiving surge, but we're certainly hopeful. The farther we get from Thanksgiving, the safer it becomes that we avoided a significant surge. The concern we have, of course, is that now we're in the season where there's lots of family get-togethers, office parties, kids parties, things like that are going to be high-risk events. So we're really encouraging people to not do those types of events this year and maintain their contact through other means.
Great, thank you.
is Mike with the Gazette again. I wanted to ask you, what are the expectations right now in the Unified Health Command about Yellowstone County, about public acceptance of vaccination? Are you expecting people to, are you expecting significant resistance to becoming vaccinated as vaccines become more available? I'm just kind of wondering what's being expected right now.
Well, we haven't polled the community. There has been national surveys on this that indicate that it's about 50-50. About half the people are concerned about the vaccine, about half intend right away to take it. One of the things that's going to happen is, depending on how rapidly the vaccine comes into town, it's going to take a while to work through those top priority groups of healthcare workers and long-term care workers and first responders. So by the time we get to the more public distribution of vaccine, we'll have some experience. And I think people will see that the vaccines are safe, that they're doing well, and that hopefully by the time we get to the more public distribution, we'll have a higher uptake and willingness to go through the vaccination process.
Do you think that some confidence could be built just as this progresses
Right.
through different groups?
Yep, but it is going to take a while. I think that's something that is one of the great unknowns. We don't know how rapidly doses will come into the community, but we do know that those top tier groups of healthcare workers and first responders is a pretty good number of people. It's going to take a while to work through that group. So we'll have some experience, and people will be able to talk about their experience with the vaccine and how they did. And so hopefully by the time we get to the general public, there'll be a better sense of confidence and comfort with the vaccines.
And obviously there's a lot of uncertainty right now about vaccination rollout, doses, when they'll be available, as we get further and further into the future. Do you have any estimated timeline right now in terms of how long this community vaccination process could play out?
Nationally what we've seen and what CDC has talked about is it's going to take through the summer and into the early fall to really get a very large proportion of the population vaccinated. So I think we just need to plan on being careful and doing what we need to do through at least the end of summer of 2021. It's just going to take a while.
You think public health guidance will change as high-risk groups are vaccinated increasingly?
Oh, somebody's got their radio on. So I anticipate that as vaccination rates increase, and particularly those high-risk groups are rendered less risky, then I think we will see CDC begin to make some changes. I think one of the big ones is related to limitations on visitation of long-term care facilities. Could whoever has their radio on please mute?
Hi, I'm Janelle Slade. And I'm Jay Cohn. For all the latest news, weather, and
Oh, well.
sports, join us Monday through Friday, 5
Any other questions?
Thanks for choosing YouTube.
All right. Thank you all for coming. Please have a safe holiday season. Thank you.
All right, we were just hearing from the Yellowstone County Health Officer, John Felton, of course, having a presser about COVID-19 numbers, the newest to kind of come out from kind of a month ago. That's when we heard him extend that health order. And today he is saying that extended health order still remains. And those guidelines include 50% gathering capacity, which we've seen for the last month, and also closing businesses at 10 p.m. Did hear a little bit about some of the CDC guidelines changing just a little bit for people who are quarantined. We do have some of that information on our website, so you can always find that there. But those days have kind of been extended. They've accordioned a little bit. So we did hear a little about vaccines and the vaccines coming into our community. We don't know how fast the Pfizer vaccine will come into the community, how rapid that will happen after it does initially come to our two major hospitals. And then also we're hearing about the cases in Yellowstone County. This is what Felton had to say. He said that we really did see a reduction in cases in the last few weeks in our region. However, locally, the largest increase was today in cases here in the Billings area. We do know new today, there have been 2 new deaths of COVID-19 related deaths in our community, 129 deaths so far in Yellowstone County. We're going to have much more on the presser from today coming up at 5:30, and we'll have a little bit more at noon, so we'll see you then.